So I just want to be clear. That means that healthcare costs won't go down overnight. Not all the changes are going to be in place. There's still going to be aspects of the healthcare system that are very frustrating over the next several years. But we have built into law all sorts of measures that in the years to come, healthcare inflation, which has been rising about 3 times as fast as people's wages, is finally going to start slowing down. We'll start reducing the waste in the system, from unnecessary tests to unwarranted insurance subsidies, so that over time, Americans are going to save money. And meanwhile, there are a set of reforms that begin to take into effect this year. So I want to talk about this. This year, millions of small business owners will be eligible for tax credits that will help them cover the cost of insurance for their employees. This year, millions of small businesses will benefit. So let me talk to you about what this means for a business like your own Prairie Lights bookstore downtown. This is a small business that's been offering coverage to their full-time employees for the last 20 years. Last year, their premiums went up 35%, which made it a lot harder for them to offer the same coverage. On Tuesday, I was joined at the bill signing by Ryan Smith, who runs a small business with 5 employees. His premiums are going up too. He's worried about having to stop offering health insurance to his workers. So starting now, small business owners like Ryan and the folks at Prairie Light, they're going to have the security of knowing that they'll qualify for a tax credit that covers up to 35% of their employees' health insurance. Starting today, small business owners can sit down at the end of the week, look at their expenses, and they can begin calculating how much money they're going to save. And maybe they can even use those savings to not only provide insurance, but also create jobs. This healthcare tax credit is pro-jobs, it is pro-business, and it starts this year, and it's starting because of you. Starting this year, tens of thousands of uninsured Americans with a pre-existing condition and parents whose children have a pre-existing condition will finally be able to purchase the coverage they need. You know, on Tuesday, right after I signed the bill, I met David Gallagher, whose daughter Lauren had written me a letter last year. And when Lauren's mom lost her job, the entire family lost their health insurance. And when they tried to get new insurance, David was denied coverage because he once had a complication-free hernia surgery. So Lauren's been worried sick about what would happen if her father became ill or injured. But now, because of this reform, David Gallagher can finally have access to health insurance again. That starts this year because of you and the work that you did. This year, insurance companies will no longer be able to drop people's coverage when they get sick, or place lifetime limits or restrictive annual limits on the amount of care they can receive. This year, all new insurance plans will be required to offer free preventive care. And by the way, for all the students who are here today, starting this year, if you don't have insurance, or if you're about to graduate and you're not sure what your next job's going to be, or there's a little gap between getting that job with insurance, all new plans and some current ones will allow you to stay on your parents' insurance policy until you're 26 years old, starting this year. Because as you start your lives and your careers, the last thing you should worry about is whether you go broke just because you get sick. This year, for the seniors who are in the audience, if you fall in the coverage gap known as the donut hole, you're going to receive $250 to help pay for prescriptions, which will be the first step towards closing that donut hole, that gap, completely. And I want seniors to know, that despite what some have said, these reforms will not cut your guaranteed benefits. In fact, under this law, Americans on Medicare will receive free preventive care without co-payments and deductibles. Darlene Neff is here today. She's a breast cancer survivor. She's fought her heart out for reform over the last few years. Today, the preventive care she needs will finally be covered without charge. That's what this reform will do. That's what's happening because of you. And once this reform is implemented, then health insurance exchanges are going to be created. This is the core aspect of this bill that is going to be so important to Americans who are looking for coverage. Basically, we set up a competitive marketplace where people without insurance, small businesses, people who are having to pay through the teeth because they're just buying insurance on their own, maybe you're self-employed, you're finally going to be able to purchase quality, affordable health insurance because you're going to be part of a big pool. By the way, with members of Congress. So you will be able to get the same good deal that they're getting, because if you're paying their salary, you should have health insurance that's at least as good as theirs. That's what's going to happen in the next few years. And when this exchange is up and running, millions of people are going to be getting tax breaks to help them afford coverage. And the credits add up to the largest middle-class tax cut for health care in history. So that's the basic aspects of reform. That's not in it. Because we couldn't get it through Congress. That's why. So there's no need to shout, young man. No need to shout. 32 million people are going to have health insurance because of this legislation. That's what this is about. All right? So, that's what's going to happen. Now, I want to just make this point. This legislation is not perfect, as you just heard. This young man's dissatisfied with an aspect of it, which is fine. I mean, that's part of what democracy is about. But what this is a historic step to enshrine the principle that everybody gets health care coverage in this country. Every single person. And it's absolutely true. It's absolutely true. This is a middle-of-the-road bill. This isn't single payer, which some people wanted. It's also not what the Republicans were looking for, which was basically to deregulate the insurance industry, arguing that somehow this would cut down costs, something that defies the experience of everybody who's dealt with an insurance company out there. So yeah, this is a common sense bill. It doesn't do everything that everybody wants, but it moves us in the direction of universal health care coverage in this country, and that's why everybody here fought so hard for it. This is the reform that some folks in Washington are still hollering about, still shouting about. Now that they passed it, now that we passed it, they're already promising to repeal it. They're actually going to run on a platform of repeal in November. You've been hearing that. And my attitude is, go for it. If these congressmen in Washington want to come here in Iowa and tell small business owners that they plan to take away their tax credits and essentially raise their taxes, be my guest. If they want to look Lauren Gallagher in the eye and tell her they plan to take away her father's health insurance, that's their right. They want to make Darlene Neff pay more money for her checkups, her mammograms.